40% of women with PCOS may have an eating disorder, compared to 10% of women without PCOS.
Welcome to the What's Eating You podcast. I'm your host, Stephanie, and I'm a psychologist, published author, and public speaker, here to educate and validate. Enjoy the show.
Welcome back to the What's Eating You podcast. It has been a hot minute, and I am excited to be back on the Gold Coast bringing you today's episode. If you're new here, welcome. And if you're a regular, welcome back. I am so grateful and proud of you that you chose to be here to increase your knowledge and improve your mental health. In today's episode, I'm going to talk about polycystic ovarian syndrome and the link with eating disorders. I'll cover endometriosis a little bit as well. I'll show you the shocking statistics, how these conditions are diagnosed, and what the solution may be for people who do struggle with PCOS. Just remember, this podcast is for informational purposes only and is not a substitute for medical or psychological advice. Now, this conversation came up because I was on a call with a lady who was really interested in completing my food freedom program, and she was struggling with binge eating, had a really toxic relationship with food, and she started to sort of second guess herself and whether she needed to focus on other areas of her health because she had PCOS. And I brought it up and said, hey, did you know that there's a big link between PCOS and eating disorders and disordered eating? And she said, no, I had no idea. And I said, yeah, so if that's something you want to improve, I really suggest focusing on your relationship with food because they are both linked. And that's why I thought I'll do a podcast on this, because many people are shocked when I bring this up and say PCOS has a high vulnerability of having disordered eating. People have no idea about it. So here are the statistics that might surprise you. PCOS, which is polycystic ovarian syndrome, and I'll explain exactly what that is in a moment, affects about 12 to 21% of women of reproductive age worldwide. And these are the similar rates in Australia. Despite this, 70% of women with PCOS remain undiagnosed. And I wonder why that is. I've heard horror stories of women going to doctors or just being told they're lazy or being told that they just need to eat better when they actually have this syndrome. And this is not to crush doctors or the medical field. I just think that a lot more awareness of it needs to be spread. We are moving into a time where we are speaking about it more openly, and hope that people do get the support they need. But 70% of women with PCOS are remaining undiagnosed. That is a huge number. And to top that off, we know that 75% of women with an eating disorder also don't seek help. So if you've got both, that even raises the statistics of not seeking help and making that number even larger and more alarming. Endometriosis affects approximately 1 in 9 Australian women by the age of 44, which is about 11%. Women with PCOS approximately are 4 times or more likely to experience mental health issues such as anxiety and depression, which we also know are linked with eating disorders. Now, let's get into this. What is PCOS? Just remember, I'm not an expert on the topic, but I do have a lot of women in my life who do experience this, and I'm going to speak on that. The disorder PCOS is referred to as polycystic ovarian syndrome due to small cysts that form in the ovaries as a result of the overproduction of androgens. Okay, what does that even mean? So basically, PCOS is caused when the ovaries or adrenal glands produce an abnormal amount of androgens, which are male sex hormones. So we all know male sex hormones as testosterone, but there are androgens. The female reproductive system typically produces some androgens, but it's a small amount. And you're probably thinking, what the hell are the adrenal glands? You've heard of adrenal fatigue. You've heard of adrenal, the word. What does it actually mean? The adrenal glands, they're these small triangular shaped glands located on top of each kidney. They produce hormones that are crucial for various bodily functions. And there's 2 parts of the adrenal glands. You've got the adrenal cortex, which is the outer layer, and the adrenal medulla, which is the inner layer. So the adrenal cortex, which is that outer layer, produces steroid hormones, including cortisol, which we've all heard about. This is the double-edged stress hormone, but it helps with our metabolism and our stress responses, and aldosterone, which helps control blood pressure. I haven't heard of that one before. And androgens, such as DHEA or dehydroepiandrosterone. And that was a mouthful. And then the other part of the adrenal glands, the adrenal medulla, produces adrenaline and noradrenaline, which are involved in the body's stress response. So long story short, your adrenal glands are associated with your fight or flight, which activates your adrenaline and your cortisol. Now we've got that under control. How do you know if you have PCOS? What are the symptoms? PCOS greatly impacts the body, and there are a lot of signs that you or a loved one may have it. And if you know anyone who thinks they might have PCOS, or they've been doubting themselves, or they've struggled with their weight or their body image, and they have any of these symptoms, send them this podcast. This podcast is not just for you, but those in your life who you love and who you care about. So the first thing is irregular or ceased menstrual cycle. So my sister is a type 1 diabetic, and growing up, she was really late to get her period and just had really irregular periods. And she does have PCOS. And again, it took years to diagnose. She suffered with number 2, which is excess body hair. Sorry, sister, for using you as the example. But I remember when we were young, she always was getting laser appointments or, electrolysis. And I had friends in high school who were, dyeing facial hair. And it really is tricky. I mean, being Greek, that's tricky enough because you already have facial hair, but then to be ethnic and then have polycystic ovaries, my God, you're just hit with a double-edged sword there. The third symptom is cysts on the ovaries, which again, that can be hard to diagnose unless you get an internal exam. I don't know exactly how they find it, but I imagine it is some sort of internal ultrasound. Pelvic pain, weight gain, especially around the belly or abdomen, abdominal bloating, back pain, prediabetes symptoms, high blood pressure and cholesterol, acne, small patches of excess skin in the neck and armpits or skin tags, dark or thick skin patches on the back of the neck, in the armpits or under the breasts, severe mood fluctuations, and infertility. And I know that my sister struggled with her pregnancy, and she did luckily get pregnant and has a beautiful baby girl. She's not that much of a baby. She's 3 now, but yes, it can definitely affect your journey and infertility. Endometriosis, on the other hand, is a condition where tissue similar to the lining inside the uterus grows outside the uterus, causing pain and potentially leading to fertility issues. So symptoms of endometriosis can include severe menstrual cramps, chronic pelvic pain, pain during or after sex, and infertility. Now you're probably thinking, well, how is it diagnosed? Well, typically PCOS is diagnosed with a medical history evaluation, a physical exam, including a pelvic exam, blood tests to measure hormone levels, and I imagine this is something you need to ask for. I've been to doctors before and I've wanted to measure my hormone levels. I wanted to know specific things, and doctors, I've learned, do have specific requirements with how many blood tests they give out. It's same with my partner. When he went to get his testosterone measured, the doctor's like, oh no, why do you want to test for that? And again, this isn't to crush medical professionals. It's just to highlight that if you've had this experience, that it is common, but there are reasons for it. I believe doctors do have a certain amount of blood tests they can give out. So sometimes you do need to seek your own path for this, or go see a clinical naturopath who can order specific tests for you. That's what I did when I was looking into my hormones, into my adrenals, into everything when I was going on my whole journey with my health. Yet it can be tricky. The third thing is ultrasound to check the appearance of ovaries and the thickness of the uterine lining. Endometriosis is the same, but you might have an ultrasound or an MRI, or you might have a laparoscopy, a surgical procedure to view the inside of the abdomen and confirm endometriosis. So It can be tricky. It can be a long journey. Just make sure you always see a doctor that is really validating and take your needs seriously and has expertise in this area as well. So now we know what those two conditions are, what symptoms might show up. Let's talk about why they're linked to eating disorders. There's an intricate connection, and we know that women with PCOS are at increased risk of developing various eating disorders. There are 3 eating disorders that they are particularly vulnerable at getting, and this includes binge eating disorder, bulimia nervosa, and night eating syndrome, which I actually have never spoken about on the podcast, so I'm going to go into that. Binge eating disorder is characterized by intense, frequent episodes of eating large portions of food in a short period of time. And this is accompanied by a feeling of loss of control during the binge. You might feel as though you're not present, that you're dissociating, and you might even eat when you're not hungry and continue eating to the point past feeling full. Unlike bulimia nervosa, binge eating episodes are not followed by compensatory behavior such as vomiting or excessive exercise. And remember, binge eating doesn't have to be about your body weight, shape, and size. There are people with trauma or with other issues who binge eat, and it's nothing to do with their weight, shape, or size. Whereas bulimia nervosa, there is this preoccupation with your body weight, shape, and size, and these individuals frequently binge eat. So to be diagnosed with a binge eating disorder, you need to be binge eating at least once a week for a month, and this needs to affect your day-to-day functioning. But even if you don't meet that criteria, it doesn't mean you don't have an eating disorder, because there's another category of eating disorders called OSFED, other specified feeding eating disorder, which could be a low-frequency bulimia. So just remember, it doesn't matter what your weight, shape, or size is, all eating disorders are serious and worthy of support. So bulimia nervosa, after these episodes of binge eating, it's followed by compensatory behavior to prevent weight gain, such as self-induced vomiting, excessive exercise, or misuse of laxatives. People with bulimia often feel trapped in this cycle and experience shame or guilt about their eating behavior. And despite common misconceptions, individuals with bulimia are usually average or above average weight, and that's why it can be really tricky to diagnose. People can be functioning, they can look like they're doing fine, and this can also feed into why they don't seek help. Nighttime eating syndrome. Now, whilst this is not currently recognized as its own separate diagnosable disorder in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Health Conditions, it is acknowledged in that other category I spoke about earlier, OSFED, other specified feeding eating disorder. So this is a category of eating disorders that still cause significant distress or impairment, but they don't meet the full criteria of an eating disorder that's, got its own category. So night eating syndrome, NES, is characterized by a delayed pattern of food intake, with individuals consuming a significant portion of their daily calories at night. People with NES may have little appetite during the day, but they excessively eat in the evening, or they wake up during their sleep to eat. This pattern is strongly associated with insomnia and a strong urge to eat before returning to sleep. How do you know if you've got night eating syndrome? A delayed eating pattern, so it always occurs at night, often after an evening meal or waking up to eat. Insomnia, difficulty staying asleep, and then that's linked to the urge to eat. Morning anorexia, lack of appetite in the morning, often accompanied by the feeling of needing to eat at night to fall asleep. And mood, individuals with NES may experience mood disturbances, particularly in the evening or night. Right, so now you know which eating disorders are most commonly associated with PCOS. Let's talk about why. Disordered eating and eating disorders impact your body's hormone productions. Many people don't realize this, but by having an eating disorder, you are disrupting your hormones. And this is why it can lead to gut issues, adrenal issues, fatigue issues, so many different things. Therefore, it's unsurprising that PCOS is associated with eating disorders. Research has found that women diagnosed with PCOS engage in disordered eating 4 times the amount of women who don't have PCOS. Another study determined that women with PCOS reported significantly more binge eating episodes and more frequent episodes of compulsive exercise in the prior month than did control groups. Now, the relationship can go both ways. We don't know what comes first, the chicken or the egg. For example, you might have PCOS, and then because of that, you're more conscious of your weight, you're more conscious of your body hair, you're more conscious of your acne, and you think, well, if I just lose weight, then I'll feel better about myself, which can reinforce disordered eating and encourage restriction. And we know restriction leads to binge, right? But then if you have an eating disorder, such as restriction and binge eating, your hormones get impacted. So that can lead to disorders resulting from hormone dysfunction or impairment. What we also know is women with PCOS report significantly higher rates of weight and shape dissatisfaction. So we know that people with PCOS can carry more weight around the abdomen, and women already are self-conscious of their stomachs as it is. So this can make them vulnerable to going on diets and engaging in unhelpful eating patterns. And sometimes they are advised to diet by their medical professionals, especially if you're in a larger body. There is, fat bias where if you go to the doctor and you have a sore knee and you are overweight, the first thing they'll recommend is lose weight rather than actually addressing the problem directly. The emphasis on weight and health is a risk factor for eating disorder, psychopathology, and behaviors. And I remember my clinical supervisor saying, and she's trained in health at every size, which is Hayes' approach. We love that approach. When you go to the doctor, if you have a health issue, say to them, if I was in a smaller body, what would you recommend for my knee pain? And literally see what they come up with, because your weight isn't always correlated to your health. Other issues that can make women with PCOS more vulnerable to eating disorders include psychological factors, because it's stressful. Imagine you're stressed about your weight, your period pain, your facial hair. That causes anxiety. That can cause low mood. That can make you low in confidence. That can make you hide out. This can lead to emotional eating and eating in secret. Family, friends, or people who are uneducated on the topic may say, you know what, just try this diet. Just don't eat carbs. I've heard people with PCOS shouldn't eat carbohydrates. I've heard that they shouldn't eat this. And they're usually likely to go on a diet and be scarred by it. And yes, there are nutritional recommendations for people with PCOS, but not at the cost of your health. If you have an eating disorder, your mental health, you've got to resolve that first. The next reason is cortisol levels. Chronic stress can lead to elevated cortisol levels, a hormone linked to increased appetite and cravings for high-calorie foods. So this can create a cycle of stress, particularly in individuals with PCOS. So for example, they're already stressing about stuff. They're stressing about their pain, they're stressing about their acne, their facial hair, their weight, their body image, potential infertility, and then they want to eat something sweet and they think, oh my God, I shouldn't be eating this. I should have lower carbs or whatever with PCOS. That then causes guilt. And then that reinforces the cycle of body dissatisfaction. So physical symptoms such as weight gain can lead to significant body dissatisfaction. Especially, imagine this, you're living a healthy lifestyle, you are exercising, you're trying your best, and your weight does not change. That can be really challenging for people with PCOS, especially when people think you're not trying hard enough. So understanding these connections is vital for developing targeted interventions that balance your physical health and mental health. So what is the treatment? What do you actually do? It's really important to find someone who can help you with both, and a holistic approach is important. So one thing I recommend is having a really good eating disorder informed dietitian or PCOS expert, whether it's a dietitian, whether it's a nutritionist, whether it's a functional doctor. Just make sure that they have expertise in that area. And PCOS differs according to your reproductive plans. And one lady who is a doctor and expert in this area, she did a podcast and I was listening to it. And one thing she said was a lot of doctors will say, you know what, come back to me when you plan on having kids. Like that's kind of the standard protocol, which is really concerning because if an individual is planning to get pregnant, treatment might involve a change in diet or activity or medications that will cause ovulation. Those not intending to become pregnant might be advised to take birth control pills, diabetes medication, or medications for other symptoms such as hair growth or acne. And yes, medication can definitely help and can manage your symptoms, but, can we address the root cause? There's also anti-androgen medications that will lower androgen levels, so the actual hormones, in people with PCOS. One thing I really help when it comes to PCOS in food freedom is changing your relationship with food, getting you to eat more regularly to help you with that insulin resistance. So insulin resistance is a really common feature of PCOS where the body's cells do not respond effectively to insulin. So insulin breaks down your food. So my sister who has type 1 diabetes, her pancreas doesn't produce insulin, so she needs to inject insulin multiple times a day, which helps with your blood sugar levels as well. And when you do have insulin resistance, this can contribute to weight gain and increase the risk of type 2 diabetes. So what they do suggest for people with PCOS is a low glycemic index type of eating plan, because foods low GI are digested slowly, resulting in a gradual rise in blood sugar and insulin levels. And this is something you can speak about with a dietitian or your functional practitioner, but there is no point going on a restrictive eating plan if it's going to trigger you and spiral you on a binge. Focus on your relationship with food before you focus on what you're actually eating. And the woman in my program has been wonderful. Like she's told her dietitian, like, look, I am not in the phase of mind to do anything restrictive or extreme. I am building my relationship with food. I'm focusing on eating more regularly. And I think that's a really great approach. But either way, you really need a care team to help you with this and also just work on your own beliefs and self-criticism. People with PCOS can be extremely self-critical when it comes to their food, when it comes to their relationship with exercise. And I would love to know if you have struggled with PCOS and you have experienced this or experienced disordered eating, an eating disorder, or challenges with the system, please let me know. Send me a message on Instagram once you listen to this. I would love to hear your story. And as always, I hope you have enjoyed this episode. Don't forget to leave a rating and a review. Take care. Bye.
Thank you for listening to today's episode. I am truly grateful for you being here. If you got something out of today's show, please take a moment to leave a rating or review. To access more resources or support, check out the show notes below. See you next time.